Hi everyone, Dr. Steph, and I'm back with a video in our multi-video series for thyroid dysfunction. The first video that I did, I talked about the typical symptoms of low-functioning thyroid, and we see how they're very interrelated with other conditions that people could be having. Today what I want to talk about is the typical story that a lot of our thyroid patients come in with, and this will sort of highlight the limitations of the conventional system as far as handling a thyroid patient, and really help explain why you might be dealing with the same symptoms even though you're taking your medication. And then in the upcoming videos we're going to be talking about the cause of low functioning thyroid, all the different things to look at, the different testing that you should be really asking for and getting done, and some of the solutions. So, all right, so the typical scenario we see, and I've heard this so many times, is a patient goes into their doctor because they've got these symptoms going on. They sound typically hypothyroid, and so they get tested for a marker called TSH, and that is one of the main hormones that is evaluated if they're looking at thyroid function. And oftentimes it's the only marker run, and from that they will determine whether or not your thyroid is dysfunctional. If it comes out normal, they will tell you you don't have a thyroid condition, but you may actually have a thyroid issue, as you'll learn in our upcoming videos, because there are other hormones related to thyroid function, and there are other glands as well related to thyroid that could be throwing things off. There's other markers to look at other than just TSH. Or they run TSH, and you do show up having low functioning thyroid or hypothyroidism, so you get a diagnosis of primary hypothyroidism. The medical solution for that is to give you some type of hormone replacement therapy. Oftentimes it would be something like Synthroid or levothyroxine. Those are the most common. If you have asked to be put on something a little bit more natural or whole, then you might be on one of the glandulars like Armour or Naturethroid. So now, if it was really as simple as getting this marker into normal range, then you would be on your medication. The thyroid marker, TSH, would come into normal range, which often is the case when our patients have been initially put on this medication. Over the course of a few months, they get assessed and reassessed until that number is in normal range. But unfortunately, for a lot of our patients, they may feel a little bit better for a period of time, but then they often feel like they're regressing again back into their old symptoms of low functioning thyroid, or they're on their medication and their numbers are coming into normal range, but they're still experiencing the same symptoms that they walked into the doctor's office with. So what has happened to a lot of our patients is they felt frustrated, and they felt like they weren't getting the help that they needed and wanted, and so they started looking for another doctor. Maybe they went from their primary care to their endocrinologist. And unfortunately, they're all kind of working under the same paradigm, and the same standard really says, look at TSH. If TSH is within normal, there's nothing medically that they can do for you. Oftentimes, this is unfortunately where patients start seeing multiple doctors. So we've had patients come in and they've got a list of 6 endocrinologists that they've been to, and nobody can seem to get these symptoms under control. It's usually around that time where a patient gets told that maybe this is a psychological problem, you have mental emotional issues, because physically or physiologically on your lab test, your TSH is normal, so there's nothing wrong with your thyroid. It's not a thyroid problem, so they may refer you to a psychiatrist, or they may themselves start to diagnose you with things like depressive disorder, anxiety disorder, a mood disorder, and then dole out a prescription for yet another medication, oftentimes for antidepressants or anti-anxiety medication. So this is how medication list grows. Unfortunately, the symptoms usually get exacerbated by some of these psychiatric medications as far as the hypothyroid symptoms, and so the misery just continues to get worse. And it's very, very common for patients to come and see us that know they have a thyroid disorder, and they're on a long list of medications at this point. And so, so that's the typical scenario, the typical story. The earlier that you get a jump on this and you find a practitioner who can do the appropriate workup and the appropriate functional testing to really determine and rule out, is this a thyroid condition, and if it is, what's causing it, or are there other underlying metabolic issues that are mimicking the symptoms of low functioning thyroid, or is all of it going on and all of it have to be handled if you're really truly trying to get healthy and well and start functioning normally again. And so that is our goal with this thyroid series. I hope you found that very helpful. The upcoming videos, I'm going to be talking about the causes of low functioning thyroid. The next video, I'm going to discuss the actual process and function of the thyroid itself, so you can see it's not just TSH that needs to be looked at. And then we'll talk later about the different testing that you should be looking for and the treatment options that are available to you depending on what's going on. And so again, I hope you found that helpful. If you have any comments or questions, please leave them below. Give us a like, a thumbs up, and of course subscribe to our YouTube channel.